Hey there, Dr. Kyle here. I wanted to take a moment to talk to you about TBI. It might be a term that you've heard if you've had an accident or injury. What it means is traumatic brain injury. And I know that that sounds scary, and people think often that that means that you are in the hospital or you're in a coma or you've had some irreversible severe brain damage. But the truth is, it happens with low impact auto accidents too. And it's very hard, it's very easy to miss for people that aren't looking for it. So, if you've been in a car accident, even if it's 10, 15 miles an hour, it doesn't matter the speed of the vehicle. It matters about the force, the angles, what you come to the table with, where's your head rotate. There's multiple factors that matter. And remember, with a TBI, you don't have to physically hit your head. There's a thing that happens when your head is what they call whiplash, or if you go side to side, where the inside of the brain actually hits the skull, and it can cause a traumatic brain injury. So the symptoms that you want to look for, if you've had this and nobody's diagnosed it for you, is a myriad of things. In addition to that, the upper cervical spine gets traumatized with a TBI, especially in an auto accident. In fact, they're starting to say now that you really can't have a TBI without an upper cervical injury as well. So if we don't get those two together, you're missing 50% of what could be helping you with these symptoms. And if you have these symptoms, you already know what I'm talking about. Ringing of the ear, sleep problems, PTSD, anxiety, depression, suicidal thoughts, headaches that just keep reoccurring, visual disturbances, taste disturbances, everything to do with this upper part of which is really you, right? Your head, your brain, your nervous system is you. So there's multiple symptoms that come out of this, and then you pair it with an upper cervical trauma injury, ligament damage injury, tendons, muscle trauma, nerve irritation, nerve problems, and it's no wonder that you're experiencing these problems, but you think it's in your head, or you think that, oh, it's just part of an accident, I'll get better. Well, that's not the case. They're coming to find that these injuries can take years to get better, if some of them don't get better at all. So, not to scare you, but I just want to urge you, if you've been in a car accident, you want to see a chiropractic physician who's trained in identifying this. We're going to do upper cervical motion x-rays. We're going to do a specialized test to see ligament damage. We're going to do a test to see if you have symptoms of TBI, and we're going to refer you to the proper specialist to identify that and create the evaluation. So we'll probably send you to a neurologist or a neuropsychologist. It's a team effort, but I just don't want you to suffer in silence, and I don't want you to think that it's all in your head, that you're crazy, or that you're being wimpy, or that you should be getting better. It's actually not your fault. It's something that happened to you. Now, if you happen to be in Washington State, I do have a practice in Kent, Washington location. I see people from all over the state that come, and we can do an evaluation on you as well. Check out your neck. I also can work with your case if you're far away and you want to urge your attorney to have your case looked at to make sure that whoever is treating you hasn't missed this. So it's called a forensic exam. So those are things that are available to you. Now, if you're seeing a chiropractor right now, that's great. You want to get treated. They should be doing some more testing on your ligaments. If they're not sure, you can always ask me as well. So my link is going to be below. You can contact me there. You can email me, ask me questions. Whether you're a patient, doesn't matter where you are in the United States, I could probably find a doctor where you are if you're not in my state. I just want to make sure that you're not living this on your own, and you're not thinking that it's all your fault or in your head, or that you're being wimpy. It's a real injury. It has real symptoms, and it has solutions to help you. So don't suffer in silence if you have this, okay? And this is Dr. Kyle, and I hope that you're healing well.